In this lecture of most common cases in physical therapy, the joint I will discuss is the knee joint, and its most common pathology is knee osteoarthritis. OAR, osteoarthritis, is a degenerative joint disease. It is an arthritic condition. Arthritis means inflammation of the joint, in which the protective covering or articular cartilage which line the bones on the tibia, femur, or patella has begun to erode or destroy, and it becomes soft and frayed. There is a cartilage degeneration. There, as the cartilage deteriorate, the bones begin to rub together. The space between the joint is decreased, and bones begin to rub together while movement, and it causes a pain, swelling, and decreased ability to tolerate various activities. The activity of daily living become difficult. In treatment of this condition, we have found a few things in particular to be helpful that reduce the patient's symptoms. What are these things? First, we have activity modification. First and foremost, modification of activity is very important. Finding the level of activity that your knee can tolerate will give activities will help in making the time spent performing them more comfortable. For instance, if you find that 1 to 2 days of double tennis week is tolerable and does not significantly increase pain, then this is your guideline. If, however, your knee really bothers you every time you try to play singles or more than a double of a week, if your uh, more progressive activity increase your symptoms, then you can decrease your activity according to your condition. Next, you have shoe wear. The use of shock absorbing insole or cursed shoes is also very helpful in reducing the pounding onto the joint throughout the day. If you use shock absorbing insoles, this can reduce the joint stress. Modification of shoe choice to accommodate insole, and preferably wearing a running type shoes has a significant amount of cushion, can reduce the ground reaction force onto the joint. The less often you stress the joint, the less overall damage in the long run. If your joints affected more, they rub more, and it's cause pain and inflammation, then it's bad for your health. So use the shoe wear. Unloading wedges. If the standing posture of your knee is either varus or valgus, or you have a knock knee or bow leg, then this also increase the stress on your joints. We have found the use of unloading wedges in your shoes is also helpful. So it can cause not loading. Then load off the involved side of the joint and distributing it more evenly on the knee, so that the not more force occur on specific joint. The evenly force occur on the joint of a knee or articular cartilage. This aid not only in pain relief but also decrease wear onto the joint. This is the unloading wedges. So you have to use unloading wedges. Next, body weight. Maintain healthy body weight that reduce the stress on the joint. If you have overweight, this can cause more stress to the joint. This is accomplished by regular activity or exercise, good dietary intake, and maintain a healthy lifestyle. Don't overweight your body. Pain management techniques such as moist heat packs, bath, and hot tubs also relax the muscles and relieve the tightness and soreness. It is also good to use a warm up prior to the stretching and strengthening program. If you warm up, this is very beneficial for next progressive exercises. The use of cold packs for 15 minutes is also effective. It can reduce the inflammation. The use of over the counter drugs such as acetaminophen, which is non-aspirin. It can also relieve pain. Always consult your physician before using a anti-inflammatory medications. You can reduce the pain. Next, we have some exercises that you can do in knee osteoarthritis. Exercise is critical component in the treatment of OA because it helps to strengthen the muscles that surround the joints and help in shock absorption, because if your muscles are weak, this causes more load on the joint. When your muscles are strengthened, the movement take place mostly by the muscles and joints rubbing become decrease. Other benefits of exercise: improve the stability, increase joint flexibility, lessen the pain, and keep your cartilage healthy by supply it oxygen and nutrients that the joints need. Stationary bike with light to no resistance, beginning slowly, is one of the exercise that is non pounding. Pool exercises such as the leg lift, smooth gentle kicking strokes, this can also helpful in case of lower extremity and also very effective in increasing strength without increasing patient symptoms. These exercises that are very helpful in case of knee osteoarthritis. Home exercises plan. What are these? Always try and precede exercises with some form of warm up. Warm up is very necessity. It can cause increase the blood circulation and prepare the body for stretching. Extension stretching. Sitting on the front edge of a chair with your leg out straight, your heel resting on the floor, and your opposite leg bent with foot flat. Place both hands on your thigh and push the leg down into the extension. Hold and repeat. Quad sets. Legs straight out in front of you. Tighten thigh muscles, focusing on the inner thigh just above the kneecap. Hold this position for 5 seconds. Repeat it throughout the day. Climb exercise. TheraBand wrapped around both knees, laying on your side with both knee bent. Lift top knee away from bottom knee, making sure not to have top hip rotate back. Leg raises you can also do with repetition and laying back on elbow with one knee bend and opposite leg out straight in front. Tight thigh muscles of the lower leg and actively lift leg in front of the level of the opposite knee and then lower it. These are some stretching exercises that you can perform at home. These are for the lower extremity. Quads, leg raise, laying back on your elbows. This can cause stretching of your lower extremity. Laying on one side with opposite leg bent and the top leg out straight. Tighten thigh muscles of the top leg and lift to the side, making sure to keep foot on the floor. Laying on the stomach, tighten the thigh muscles and lift leg behind you a few inches off the floor and lower, making sure to keep hips on the floor. Laying on the one side with top leg bent and foot on the floor in front of a bottom leg. Tighten thigh and lift leg towards the inner knee while foot on the floor. Seated marching, bridging exercises. These are all helpful. Sitting marching, what is it? Sitting up straight on the corner of a bed with the hands on the hip. Lift one knee and lower, then alternate. Make sure not to rock side to side and progress to standing or sitting on a physio ball. Repeat and do 2 sets of repetition. Bridging exercises, laying on the back on floor with both knee bent, feet shoulder distance apart, and TheraBand wrapped around both legs just above your knees. Press feet into floor and lift hip up so your body is straight from knee to shoulder. Tighten gluteal muscles and maintain knee position against the band. This is the resistance exercises of your knee. Calf raises, go up and down on your toes and do 25 repetitions. These are all the stretching and strengthening exercises of the knee. In this lecture, I will discuss about the knee osteoarthritis, its all treatment protocol. I hope so you like this video. Thank you.